Okay, all right. Good afternoon, listeners. You're locked into WVOE, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. So today we're going to tackle something that's a little bit of a difference. Of course, the last couple of sessions we've been talking about kidney disease. So one of the things that happens with people that have kidney disease is that you actually are considered kind of immunosuppressed, especially patients that are on people that are on dialysis. And of course, all of us are kind of susceptible to getting these sort of what we call viral infections. And there's always lots of questions about the different viruses and what goes on there. And of course, as I'm a kidney doctor. I'm a doctor, not your doctor, of course. So always reach out to your primary doctor, your clinician, uh, for about what things of nature, general information. So you be smarter when you go talk to your doctor, right? So one of the big things to remember about kind of cold and flu season is that these colds and flus. These are viruses. As opposed to what we call bacterial infections. And viruses are kind of, you know, really small agents that kind of cause illness in us, as opposed to bacterial, which are the types of things that we treat with, more like with antibiotics that people are familiar with. But of course, sometimes it's a little difficult to tell, although usually the bacterial ones are usually pretty significant. But the other question that people ask a lot of times is like, hey, how am I supposed to know if it's a cold or a flu, and what's and things of that nature. And then of course there's always this thing called RSV, respiratory syncytial virus, is also out there as well, which we'll kind of touch on a little bit, but we'll try and focus a little bit more on the cold and influenza. But they're all kind of in the same category of what we call viral, more kind of viral infections. And the common cold is usually a little more gradual onset. You kind of feel not the greatest over a couple of days. Most people that get the flu is usually pretty sudden. If anyone's ever had the flu, you kind of wake up, you got the chills and fevers, and that's usually what's more the flu. And then of course you got for cold, it's usually a little more mild. Usually you don't have you actually don't tend to not have an actual fever with colds, as opposed to flu, where you almost always have a fever. Sometimes with the cold, you might have a kind of a mild to moderate cold cough. Whereas with the flu, typically it's a dry but usually persistent, and can get pretty significant. So you kind of know you got that cough there. Sore throat, sometimes you can have that, but sore throats are usually a little more common with the cold than they are with the flu. And of course, a little nasal congestion is more common. It's the cold as opposed to now, then you got issues like body aches. So the body aches for a cold usually are very mild if they're at all. Whereas the flu, like I say, yeah, again, if people have ever had the flu, like I say, you really, you just want, you kind of, you got chills and aches that seem like they just can't make them go away. You really want to be on those covers there. And in terms of duration, usually those colds are usually a little bit shorter, whereas the flu is usually a little bit longer there. Okay, so these are kind of the big things between the two of them, and of course your colds usually just rest. Where the flu, there actually are some medications you can use if you get them started within a couple of days. Okay, so just remember that the flu, which is a little more severe, is you has medication that can use to treat it. And speaking of viral infections that can be treated, we're also going to throw in there that COVID, which I think we've heard of that a time or two. So of course, COVID also has a medication that can be used for it as well. So let's think about this. So the next thing we want to touch about is kind of how do we manage this flu season, this cold season that's coming on around here. And one of the things we want to think about is like what can we do to kind of minimize getting it, and then what sort of things can we take to kind of get over it. So of course, in terms of flu, COVID-19, and even that RSV that, like I said, is a little less well known. The recommendation is still vaccination. Okay, so that's kind of the recommendation from the CDC is for everybody to get vaccinated for these. And of course, it got specific populations, which when you talk to your clinician, they'll let you know, like I said, whether or not you're in that population that should be vaccinated. For the flu, it's pretty much everybody really. And whereas for COVID-19, especially for this year, I think it's pretty, for those folks that are 65 and up, it's pretty much those people are easily covered. And for those that are under 65, definitely go talk to your primary, to your clinician to determine whether or not that vaccine is right for you. So that's the best way to deal with it at this point in time. The RSV vaccine, RSV is more so for younger kids, because that's who it usually hits, and then older individuals. So like I said, if you're 65 and over, again, talk to your doc about getting that vaccination, because that's those things are that population is who normally it gets affected by the RSV. Okay, so so that's kind of our standard recommendation is of course get the vaccine, and that's supposed to kind of protect you, but you always want to talk to your primary to make sure that that is a right treatment for you, or right prevention for you. Okay. Now we want to get to what I call non-pharmacologic approaches, which people want to ask all the time, of course, whether or not supplements work, whether or not lifestyle changes work, comfort foods. And this is a little more difficult. Now, I will say overall, especially in terms of official recommendation, they're going to recommend, vaccines first. If you qualify, you're in that group, and then these non-pharmacologic approaches are kind of what we call adjunct, or do you layer that on to kind of the standard recommendation from like the CDC, okay, CDC and your primary doc. So that's the way you approach this, because most of these non-pharmacologic approaches, for the most part, they're not really things that have a lot of harm. Now, some of the supplements, of course, if you take extra, that might cause a little bit of an issue there. But most of this is really, most of it's really not harmful at all. You're just kind of adding on to what you're already doing. Okay, so let's see. So let's think about something. So I think probably one of the most popular ones is vitamin C. Okay. Hey, everybody heard about vitamin C. I think everybody knows that you go to the pharmacy and it's on the counter. You can take supplements you carry around with you. Okay. Now, there are some studies that suggest that there might be a little bit of a decrease in cold duration, and maybe a little bit of reduced severity with your cold whenever you take some regular vitamin C supplementation. So that one has a little bit of a benefit. Now it's interesting because sometimes you can take the supplements, and then sometimes you can supplement yourself with food. So with vitamin C, of course, there are certain foods like citrus fruits, citrus fruit, bell peppers, things of this nature that have a lot of extra nutrients in it, have a lot of extra vitamin C, and like I said, that stuff seem to support quote unquote immune health, and so it seems to be pretty helpful there. Okay, now one thing that they did, at least from what I can see, kind of glancing around what I found out, is that vitamin C seems to be more helpful with colds than actual flus. So, like I said, there's not a lot of strong evidence at all. Like not even like the study we stated before was kind of suggestive. Whereas for the cold, but for the flu, really, they were like, yeah, this stuff doesn't, it really doesn't work as well. Okay, so but like I said, like these immune boosting nutrients, they think that this just kind of helps the immune health just kind of in general. So it's not a bad thing to do. Okay, and especially if you're getting your vitamin C from food as opposed to just kind of regular supplements. Okay, now another one that is kind of popular is zinc. And so zinc seems to have some actual evidence that supports that the use of zinc can actually be effective at reducing the duration and severity of the common cold. So good. So so it's zinc sometimes with vitamin C can be significantly more efficient than just nothing at reducing like kind of runny noses and stuff of that nature that are that that occur with the common cold. And so that this one looks like it might be a good one. So when you talk to your doc about it, you want to reference that the suggestion for one of these meta-analysis where they go through it and look at a bunch of studies and pull together was recommending about 75 milligrams a day, and it seems to increase your recovery rate from the common cold. So that's okay. So that one may not be too bad. So and this is zinc lozenges, and you have to start this whenever your cold starts. So make sure you mention that. And also, yeah, like I said, for all this stuff, make sure you're running this by your doctor before you go try it. Okay. All righty. So those are some of the things that some of the supplements, at least, that I think most people kind of cover. Now, now in terms of lifestyle, it does seem like regular exercise seems to be what we call immunoprotective and supports your kind of general health. So this seems to be a good thing to do whenever you're in order to prevent um, getting colds and flus, and also kind of recovery as well. Like I said, a lot of the data is not really strong for this, but it does seem to be, well, it seems to be suggestive. Plus, it's not really harmful. Like I said, so you definitely want to continue to consider that as well. So we got that. So that's regular exercise and lifestyle. So one of the things you want to do is that you don't want to kind of stop all of your activity just because you've developed a cold, because it looks like that stuff can be um, um, like stuff can it continue to be helpful even even when you're sick. So keep your exercise going. Of course, you might want to avoid going to a gym and maybe work out at home away from everybody, but you don't want to spread it, of course. But yeah, still, even though you may feel not the greatest, you can continue to exercise for the most part. Okay. All right. So we got the supplements that we talked about a little bit. We've also talked about, kind of exercise. So like I said, continue that going. Now let's see what we got with some of the comforting foods. So one of the best known ones is going to be chicken soup. Okay. And there are some studies that suggest that this does truly kind of help fight some infections for your colds. I think there was one study that says it does somehow it concentrates the white blood cells that kind of help fight infection. I didn't look up exactly how that would happen, but it looks like it might do that. But it is it does seem it's not curative. Remember, all these things are not curative. Uh, but like stuff like chicken soup, of course, it is a what we call a cultural comfort food. So it makes you feel better. It also has it has good amount of protein. It has zinc actually, vitamin A. Vitamin A actually the zinc is from the chicken. The vitamin A is from the carrot. Vitamin C is from the celery and onions. You also got some antioxidants in there, and then you also got fluids and electrolytes. So all that stuff is in your chicken soup. So that's what's going to be kind of helping you. So, like I said, even when you go in, say you go in the hospital with, illnesses and stuff of nature, remember that's, what do we kind of give you? We kind of give you fluids. So if you take in that chicken soup, sometimes it's, because you're not feeling that well, you don't want to eat regular food. You take in the chicken soup, and that chicken soup is actually providing you with some of the nutrients that your body needs to kind of help fight infections. So so a lot of this stuff is, well, I said, while it's not curative, so it's not like you can you're gonna take chicken soup or zinc or something and it just completely goes away. It does seem to be very supportive of our immune system, also providing us with the nutrients we need in order to kind of fight infections. And so it's something that you can easily, I would say, easily layer on to your easily layer on to what you're doing to prevent developing infections during this flu and cold season. Okay, so don't just brush it off. So like I said, it can be pretty useful there. And let's see what else we got here. So the other one we want to talk about is kind of, so we talked about vaccine, kind of your baseline there. We talked about some supplements. We talked about vitamin C. We talked about zinc. Then we talked about lifestyle. So in terms of continuing with some of your activity, don't cut everything out. I want to take it easy though. Don't work yourself too hard, but you definitely want to continue to move while you're doing that. And then also the effective support from comfort foods such as chicken soup. So we got all that going on there. Now, the other thing we want to remember, and this is like going back to our COVID days, I guess, is that there are other things that also continue to help to prevent from acquiring the virus and also from spreading the virus. So hand washing, still, you still want to make sure you're washing those hands. Or if soap and water is not available, then you want to make sure that you're using hand sanitizer in order to prevent acquiring, or if you touch something, you're able to wash off those viruses off your hand. Because remember, a lot of these, especially stuff like the cold, that's how you get infected. Is actually you touch a surface and then you touch your eyes or your nose, what we call your mucosal surfaces, and that's how you actually get infected. So you want to make sure you're washing those hands. So when you're going around throughout your day, whether at work or shaking people's hands, before you sit, definitely before you sit down and eat, you want to wash your hands. But even sometimes throughout the day, you might want to just kind of wash those hands off, because a lot of times we're touching things that, and not really knowing it, because a lot of times you just touch stuff, and then you unknowingly touch your face, and that's how a lot of people get infected. Okay, so you want to frequently wash your hands. Of course, you want to avoid close contact with people who are ill. So hopefully they let you know so that you can kind of avoid them a little bit. You also want to stay at home if you're sick to avoid spreading infection. That is, if you're able to, if it's not too burdensome. Like I said, the mask. So the mask, if you're in crowded spaces, and especially if you're at high risk, you still want to consider using that. And the thing about masks, so those little simple surgical masks that we used to use during COVID, remember those are to protect other people, because their primary role is to keep the person that is sick from passing that illness on to others. It contains the droplets. If you really say you're somebody that has immune deficiency, or you really say, look, I just don't want to catch anything, then in those cases you want that more significant mask called the N95, and make sure it has a good seal, because that's the way to protect yourself from getting infected. From those viral particles. Okay, so so you want to continue to think about those masks. Okay, you want to make sure you got good ventilation. So wherever you are, you want to make sure that there's lots of, if you can open the windows, open the windows. I know sometimes it can be hard when it's cold, but otherwise, you want to make sure that you're doing that. And you want to get and another thing. that you want to consider is sufficient sleep. Okay, sufficient sleep, maintaining good nutrition. You want to do these things in order to, kind of prevent yourself from um, uh, making yourself more vulnerable, if you will, to these viral illnesses. So make sure you get good sufficient sleep. Continue to exercise as you were doing before. You want to make sure you're getting good nutrition. So, like I said, make sure you get some citrus fruits, things of nature. And of course, if you got chronic diseases, make sure you stay up to date on those. So those are kind of the big things for what you can think about whenever you're trying to avoid getting these infections throughout the the cold, well, I said the cold or flu season is really what it is to think about these things. So that's pretty much it for today. So like I said, I just want to kind of bring that stuff out to folks, kind of bring it up to everyone's mind, with especially the issue with the vaccine, because, things have changed a little bit this year. So you want to make sure you talk to your doc about the vaccines, especially if you got any specific questions about how, about your whether or not that vaccine still is right for you, or if you got just questions, concerns, make sure you address that. And then, of course, if even if you get the vaccine, whether you get the vaccine or not, just make sure that you're maintaining good health habits that we talk about here all the time. So you want to make sure that you're continuing your exercise. You want to make sure that you're eating good healthy food, that you're getting enough sleep. So you want to make sure that stuff is going on as well. In terms of, if you do get it, and like I said, you want to, like I said, of course, it sounds like zinc can kind of help you out a little bit. If, even beforehand, you might want to look at vitamin C. And like I said, you can get the vitamin C from some of the citrus fruits that are around this time of the year, like the oranges and stuff of that nature. And then, in terms of prevention, continue to wash those hands, wear a mask if you have a cold, to keep from spreading it to other people. And that if you are a person that is susceptible to cold, maybe your immune system is down a little bit, make sure you use those N95s, and we'll kind of go from there. So I think that's pretty much it for today. And then next week we'll be back again with another episode of Health Facts.
We thank you for health facts today. We want you to have a very blessed one while you're in North Carolina.
All right, thanks a lot. You take care, and have a good day.
You too.
Bye-bye.
Brothers and sisters, you have been listening to Health Facts here at WVOE with Dr. Christopher Brown. We want you to stay with us and be blessed as we continue with the program here at WVOE.